Hello, Mrs. Adams. I'm glad you made it to your hospital discharge appointment. While you were in the hospital, we discovered that you have what is called heart failure.
That sounds kind of scary.
It is serious. If we don't treat it carefully, you could land back in the hospital.
I'll do whatever you say.
While you were in the hospital, did the nurses give you a list of medications and instructions about diet?
Yes, but
Well, if you'll follow those, you should do fine. You look good today. I'll see you again in a month.
okay, I guess I can do that.
This scene shows what can happen when patients with a serious illness come to a medical appointment alone and do not assert their needs. Appointments are short, and professionals try to pack in as much information as possible. Patients are often scared or ill and may not be able to absorb all the information and are not comfortable asking questions. To avoid this problem, bring along a friend or relative who can listen, ask questions, and make notes. Together with your friend or relative, 1. Get all the details of your health problem and how serious it is. 2. Ask questions about tests and treatment choices. 3. Write down and remember medical instructions. Hello, Mrs. Adams.
Hello, Dr. Wolfson. This is my granddaughter, Jenny. She came with me today to listen and help me ask questions.
What a good idea. 2 heads are better than 1. Nice to meet you.
Could we start with a few questions my grandma had from her last visit? Grandma, why don't you tell Dr. Wilson what you were confused about?
Well, how serious is this heart problem? And the medicine you gave me will cure it, won't it?
Well, heart failure is quite serious. If it's not treated aggressively, you can land back in the hospital. There is actually no cure for heart failure, but we really should be able to control it with the medications.
Well, how serious is my grandmother's case?
As heart failure goes, it's mild, which is all the more reason for us to get on top of it, stay on top of it, and see to it that it doesn't get worse.
Thank you for explaining that. Grandma told me she wasn't sure of what to look for and when to call if her symptoms change. Could you explain that, Dr. Wilson?
Another good question. You should start by weighing yourself daily at roughly the same time and roughly the same degree of clothing each day. That way you can call me if you gain more than 3 pounds in a day, if you develop more breathlessness or more leg swelling.
That's a lot for Grandma to remember. Could you give us some sort of handout?
Sure. This chart will tell you when to call me and when to call 911. I think I'll ask the visiting nurses to drop in on you. They can visit you regularly for a while, check on your medications, instruct you further about diet, and make sure that you are doing everything you can to help yourself.
Thank you, Dr. Wolfson. It's scary to know you have a serious health problem, but now I understand better how to take care of it.
I'm glad.